Hi, I'm Dr. Michael Moreton. I'm the International Medical Coordinator at the Bangkok Hospital in Bangkok, Thailand. I'm originally from Britain, but I am a Canadian citizen, spent most of my life in Canada. I came to Asia 15 years ago and spent 10 years in China, and now I've been 3 years in Bangkok. I'm representing my hospital, Bangkok Hospital, and I gave a talk on how we treat our international patients in the hospital. And I'm also here to learn what I can about the recent trends in medical tourism. Well, I think that we have never regarded America as a very potent source of patients. Only 3.6% of our patients are American. We have many, many, many more Europeans than we do Americans. However, having heard what I have about the new health plan in America today, I am revising my thoughts about America as a potential market for international patients. One of the things that drives up medical expenses is defensive medicine. I have worked with American doctors who have come to Asia, and let me tell you, it takes 2 years to get them out of the habit of practicing extremely defensive medicine. In Britain, where I've practiced, and in Canada, where I've been practiced, we are very careful, but we do not practice the extensive amount of defensive medicine, ordering tests merely to make sure the chart looks good in case any lawyer is looking at it. I think the standard of medicine at the Asian hospitals that I have worked at and which I've had experience is excellent. I think we practice careful medicine, and although we don't practice defensive medicine, all medicine to some extent has a defensive factor in it, and we're careful to be sure of our diagnosis and careful with our treatments. Europeans generally travel more than Americans. We find that of the American patients that come to see as a patient, the vast majority have visited Asia previously for other reasons, either work reasons or vacations. So for an American sitting in Kansas City to decide, I want a hip, I will go to Asia, is a very difficult decision. And I think, however, with the current problems, that this may change. Canada, Britain, Australia all have government-run systems, and one of the problems they all have are long waiting lists. And I suspect one of the effects of the new health bin will be longer waiting lists. This is going to be a driving factor in Americans seeking care outside the country, as well as the expense factor. I think the session that I contributed I obviously think was the highlight of the whole show. I learned a great deal in this morning's presentation about the American healthcare system, which I wasn't terribly interested in until I went to the meeting, and I found that it has really turned me around into my feelings about America as a potential market for us obtaining visitors. Yes.